Hey, what's going on, good people? It's your boy James Harris, of course, Mental Heal. Listen, I appreciate all the support over the years, whether it was for my book, man, Just Express Yourself, which is an interactive planning guide for boys and men to better express themselves. So salute to those parents who got it for their young sons. Praises to those partners and couples who got it for the men in their life. Of course, to the schools, the administrative, and everybody else who ordering the book by the dozens. I definitely appreciate that. And also salute to everybody who supported me on Cheesy Date Board Games, which is a good game for adults and couples, your game night, your date night. So many interactive ideas come from it. I definitely love the responses that it's garnering. But now I'm asking for your support again on this YouTube journey. I'm back. I took a little break because I had so much going on, but be a little bit more consistent with it. I got a couple interviews lined up with prominent people and people doing phenomenal things within the community or within this mental health space or even different authors and things like that. So bear with me. Appreciate your support. So make sure you like, share, and subscribe. And the guest that I got coming up now is
My name is Dr. Aubrey Grant. I'm a clinical sports cardiologist. I direct the sports cardiology program at Medstar Heart and Vascular Institute. And in that role, I'm able to have relationships with most of the professional teams in the DC area. So, cardiology consultant to the Baltimore Ravens, Baltimore Orioles, Washington Capitals. And I work with pretty much all the collegiate teams in the DC, Maryland, Virginia area. So, again, a sports cardiologist. I also think deeply about the way healthcare is delivered. And so in that way, I am the chief medical officer for a virtual reality company called Equity Commons, where we help doctors be more empathetic and understanding for how they deliver care to patients.
Man, it seems like you got a lot going on, which is a good
I'm
thing.
busy.
That heart health is definitely important, and a lot of people, I don't want to say tend to ignore it, but not understand the different functions of the heart and why cardiologists are important. So, if you could, can you just break down the difference between the types of heart disease, I would say?
Yeah. So it's really a broad spectrum of disease, to be honest. I think the thing that, we most get sort of enticed about are heart attacks. And so what actually is a heart attack? A heart attack specifically occurs is when you're not getting enough blood flow to the heart tissue to support whatever movement or whatever activity you're trying to do. And so that can be dramatic, is oftentimes displayed on movies or TVs where people have this crushing chest pain, but also it can be more subtle. Sometimes there are things such as silent heart attacks. Oftentimes we see that in our diabetic patient profiles. And so the heart disease profile is really sort of an umbrella term that has a lot of different ways in which it can manifest. Additionally, we think about hypertension. That can have significant effect on heart function as well too. So sometimes that can be manifested as heart disease as well. It's really just sort of this umbrella term of, heart disease that has a lot of different pathologies that falls underneath of it.
Yeah, so I'm glad you was able to break down the difference because, like you said, people do understand or hear the most common one, which is heart attack, but it's so many different variables to that. So for the people who don't get physicals, I guess, every year or don't do basic lifestyle modifications, whether it's cardio or working out and exercise or even eating clean, because that can definitely have an impact on your heart as well. What can they do to keep that numbers down or within a moderate pace? And what should those numbers be typically, I guess?
Man, this is the perfect question, to be honest. I get frustrated a little bit in my job because when I take a step back and think about it, heart disease is still the number one killer of people in the United States. And it takes people out every single day. We have, episodes of heart attack, heart failure. Heart failure specific is when the heart function gets weakened due to some of these chronic conditions. But what's most interesting is 80% of heart disease is preventable. Things like diabetes, things like hypertension, things like hyperlipidemia, these are all sort of the building blocks that ultimately culminate in heart disease. But as I was mentioning, many of these things are preventable. So knowing your numbers is a big part of this. So for example, let's just talk about cholesterol. So there's all different types of cholesterol. There's LDL, HDL, VLDL, small particle, all these different types of things that are certainly helpful for a cardiologist like myself, but for patients, really one key number, one key variable that we want you, or biomarker that we want you to be aware of. So LDL is critical. It tracks directly with atherosclerosis, plaque buildup, and that's sort of the narrowing in the heart arteries. And so for the general population, we want your LDL to be less than 100. So the average LDL in the United States is 130. And so if you keep a 130 for most of your lifetime, that'll buy you a heart attack at about the age 60, 65, just averages being on average. And so you can imagine how many 130s I see in my office. And then people end up coming to me later after they've had a heart attack and they're wondering, how did I get here? And, it's interesting. If you look at sort of histology studies of postmortem teenagers that have died of, other causes, we start to see plaque and cholesterol in those arteries in the teenage years. So this is developing early on in our lifetimes, and it's slowly progressing. Ultimately, when we're 40, 50, 60, that's when we're most at risk for critical events to happen. And so LDL is a really important number to keep in mind. 100 is usually the target set point. Now, specifically, if you have a family history of heart disease, sometimes we want that number to be a little bit lower, and we want to be a little bit more strict about managing the cholesterol. Other things like diabetes, in particular, we really, we really value the effect that blood sugar has on heart arteries. So, we want people to keep close awareness of their A1C, and so having an A1C less than 6 generally supports good heart and vascular health. And then the last number I'll just throw out there is your blood pressure. And so blood pressure, you take the cuff here and you have your doctor or your nurse sort of measure your blood pressure. And the main number that I want people to focus on is that top number. And generally speaking, we want people's blood pressure to be less than 120. Numbers above 120 is generally stage 1 hypertension. So 120 for blood pressure, less than 6 for A1C, and then less than 100 for LDL are key metrics, key biomarkers to keep an eye out for.
I appreciate all that educational information. I tend to go to the doctor, for my annual exam, and then I do a couple checkups in between, in addition to if something else is happening. I'm just one of those people who go to the doctor because I can. I can go to the VA for free, or either I can use my insurance and go to somebody outside the VA. So I guess that's a luxury or a privilege, depending on how you look at it. But for the people who tend to be fearful of the hospital or doctors or don't get physicals. Let's just say they do decide, hey, this one time, let me just get a full body checkup. What type of test should they request or order besides like a EKG and or the blood pressure test? Like what should they ask the doctor to ensure that they have good heart health?
And you sort of nailed the critical issue on the head there, to be honest. And at some point, I would like to pick your brain about this and sort of understand how you think about the relationship between Black and Brown communities and the anxiety that we present towards getting healthcare. And so I see this so frequently. I saw a patient this week, older Black gentleman, 57 years old. Unfortunately, he had a cardiovascular arrest. So what does that mean? That means his heart stopped beating. Now, we were able to resuscitate him, get his heart back functioning, and I saw him in the clinic, and his heart stopped beating because unfortunately his chronic kidney disease had progressed and he was in need of dialysis, urgent dialysis. And because of the electrolyte abnormalities, that caused his heart to stop. And so when I talked to him in clinic, I'm like, man, how did you end up here? How did you end up with chronic kidney disease? And he was like, well, man, when I was in the military in my 20s, they told me I had high blood pressure, but I was so scared to get my blood pressure checked all throughout my 20s, my 30s, my 40s and 50s that he just never went to go back to get an assessment. He never saw a follow-up to get treatment, to address the issue. And then as we're seeing him, it's in extremis. And fortunately, the outcome, we're able to resuscitate him, but now he's on dialysis. And as I'm mentioning, many of these things are preventable. And so, from my perspective, the healthcare space has not always been a safe environment for Black and brown voices, specifically to be heard, to feel like you're being taken seriously, to feel like you're truly being understood. And so, as a provider, as a clinician, it's essential that we create an atmosphere where it's more of a shared decision making process, where we're inviting you to have a say so in how you're being managed. And it's not necessarily me just telling you what to do. That being said, we do have a long list of diagnostic tools to aid and really sort of help us take care of people. And this is, the beauty of modern medicine where we've advanced so much. So tools that we have available, we have ultrasound where it's called echocardiogram, where we can take ultrasound pictures of your heart to look at the structure, the function, the size, the shape, all different things. We have cardiac CT, where we can non-invasively look inside the heart arteries to see if you have any plaque buildup. We can check the blood for certain biomarkers. We mentioned LDL cholesterol. There's also a new potential biomarker that reflects your genetic risk for heart disease, and that's called lipoprotein A. That is a valuable asset to put in your back pocket because that will accelerate your risk for premature coronary artery disease. Additionally, we have cardiac MRI. That's a way to look at the tissue integrity to understand how the tissue is sort of folded on top to see if there's any inflammation in the tissue. And there's really a long list of tools that we have available. Now, the best test that I could say if you have some risk or some family history of coronary disease and you're worried about it could potentially be a coronary calcium score. Now, this is a plain CT. We're just in the machine about 10, 15 minutes, and we're taking a quick scan to see if you have any identifiable plaque in the heart arteries. And that can be a really helpful tool for someone who, might not be that engaged with the healthcare system. Now, the one thing that I will also point out, and some people don't know this, you don't necessarily need a doctor to go get all of these tests. So for example, if you have a LabCorp or a Quest that's nearby, you can out of pocket message them and pay to get your cholesterol checked, your A1C checked, or that genetic marker for lipoprotein A. And it doesn't necessarily need to come from a doctor. Additionally, if there's perhaps an advanced radiology nearby, you can schedule a coronary calcium scan on your own to really, take initiative to understand what's happening inside your body.
No, I appreciate that helpful tool because a lot of people don't have insurance and or they just don't want to, go to the waiting room and have to wait and get all these tests, and it can be fearful. So if they can do something like go to a specialist and or a Quest Diagnostic or one of those sub clinics to just get those numbers, I think that'd be great. Or at least put them on advisement that hey, something potential can happen. So now, yes, go to your full-fledged primary care physician. So you touched on a couple of different things. So I want to bring it back. So for the people who do have high blood pressure, what are some suggestions that they can do to get their numbers down? Because ultimately, yes, that can potentially impact their heart. Some people feel like, all right, cool, I can do the lifestyle modifications, whether it's diet, not adding too much salt, or, I can start to walk and do cardio. But are there any other things that they can do?
I mean, the thing that I see the most in my clinic is stress. And to be honest, we are a resilient people. And oftentimes we don't understand the weight and the burden that our environments are adding onto our lives. And it then sometimes can manifest in things like blood pressure. Blood pressure sometimes can be a manifestation of over adrenergic state, meaning you're chronically sympathetically activated, and that's triggering your arteries and vessels to squeeze and narrow in ways that increase your blood pressure. So, stress management can be so very helpful to mitigate a lot of the hypertension that we see in the clinics. Some of the evidence based tactics are mindfulness, meditation, breathing techniques. And then if you do believe in something higher, prayer, it's certainly a valuable resource in order to calm the sympathetic activation. All of those things are sort of non-pharmacological things that we think have significant weight. Beyond that, one thing that is not often talked about is sleep apnea. I see so much sleep apnea. In particular, as a sports cardiologist, a lot of my larger football athletes, they have these sort of bigger necks, and that can portend to increased risk for obstructive sleep apnea. So oftentimes, if you do have higher blood pressures, it's reasonable to do an at-home sleep test to rule out whether sleep apnea is contributing to the hypertension that we're seeing. Sleep apnea essentially is where your oxygen levels go low while you're sleeping. And so there's periods of time where you stop breathing. And so your body responds to that with a sympathetic activation and elevated blood pressures. You hit the head on a lot of things that you previously just said about diet, exercising, eating the right things. Sometimes it can be really hard to put that into practice, into real time. And so, the larger sentiment that I try to express to my patients about, this sort of lifestyle modifications is really a paradigm shift. Oftentimes as adults, we're prioritizing everything else but ourselves, right? And so when I talk about lifestyle modification, yeah, diet, exercise, but it's a mindset in that you are prioritizing yourself. It's a form of self-care. It's a form of self-love because you can't pour out into others if you haven't poured into yourself.
Hey man, listen, I appreciate you too for recognizing that the mind and the body is essentially one. So it should be a holistic approach. I remember when I first started, maybe I think undergrad, it was still the push of, mind and body being separate. So people didn't really acknowledge, and people being doctors or psychiatrists or psychologists, they didn't acknowledge the fact that hypervigilance and stress can impact hypertension and heart disease and so many factors. And of course, the other doctors too, meaning probably not cardiologists, but PCPs and all those other people didn't recognize the impact that those stressors can impact your day to day as well. So now, 2025, they recognize it because even if you go to your PCP or most of them, they give you like a questionnaire. Are you stressed or are you depressed? Have you had different symptoms? So I'm glad now the shift has become more a holistic approach over both sides, the mind and the body. So I appreciate you touching on that. So
To
for
be honest, though, we have to keep going, man. It's not
yeah,
enough, right? So, for example, in my clinic, I'm oftentimes seeing people. So, I'm blessed in the sense that I do sports, but I also do general cardiology. And so I get to see the full spectrum of what healthcare can look like in the United States. So, for example, for our elite professional athletes, they really are operating at the sort of concierge care level of, of health awareness and health maintenance. And on the other side of that, I work in inner city Baltimore. And so, in some of these underserved communities, their touch points with the healthcare system are few and far between, right? And so, in that space, I've sort of recognized that there are multiple different ways that people experience the healthcare system. That being said, it's difficult for me as a cardiologist to lecture my patient on taking their guideline directed medical therapy if they have food insecurity, if they have housing insecurity, if they're having crises in their families that are creating all this sort of social and environmental stress. And so, I think it's an important thing that we're asking patients, do you feel depressed? Are you sleeping, et cetera? But it has to go a step further. If we're not truly addressing the social determinants of health for many of these patients, we're going to continue to see the same outcomes.
correct. And similar to you, after they leave your office or after they leave my office, they tend to still go back to their environment, which is going to, not necessarily have those functions that their ability to change. So I see that a lot within practice. We can implement as much as we want here, but if you're going back to an environment where it's going to be, people being cantankerous or abusive or, just not identifying your triggers and forcing boundaries, then yes, your behavior is going to regress. So similar to what you're talking about, if they going back to an environment and all they have are these nutritional items that are high in sodium and or not as nutritious, then yes, that is going to contribute. So I appreciate you touching on that, man, and mentioning
Totally.
that because that is definitely important.
For sure.
Now, you mentioned earlier cholesterol, and you also talked about plaque buildup. So, what are some other ways that cholesterol can impact heart health, and how can it be like high? Because some people flirt on that borderline of having high cholesterol, so your doctor may prescribe you something, or they may suggest different things to you. But like overall, what's the impact of cholesterol on heart health?
Yeah, cholesterol is a really interesting thing because cholesterol in and of itself is not necessarily bad. We actually use it for our body for energy, for executive functions, for all these sort of useful things. But in excess, that is when it becomes a problem. And so you have LDL, it's a particle that floats around in the blood. And as it's randomly floating around in the blood, it can collide with the arterial walls of the vasculature. And so in those collisions, sometimes the LDL actually gets stuck. And as it gets stuck, it forms this sort of fatty streak. And so your body then recognizes that as inflammation and then attacks that inflammation. And that is what starts the process that we deem atherosclerosis. And over time, if you're continuing to have cholesterol in high concentrations in the blood, it will continue to support that process. And after a while, then the blood flow, the diameter of the artery is so large. If it's this to start and atherosclerosis has, narrowed this diameter down, at some point, you're not going to be able to get enough blood flow to your vital organs. And that's when people get into trouble. And so, again, it's just a surveillance of the biomarkers throughout your lifetime to make sure that you're staying within range. One challenge that I often see in my role as a clinician is, people will have high cholesterol, they'll have perhaps a family history of heart attacks, et cetera. But then they also have this sort of medical misinformation that statins, the main treatment for hypercholesterolemia, are bad. And statins cause dementia, statins will cause your hair to fall out, statins will cause all these sort of negative effects. And then the other thing that I often get from patients is like, how much money are you getting to prescribe me this statin medication? And I always find it funny. No one ever pays me for these things, right? And so I just want my patients to be safe, and want them to live in a space that has safe numbers, and their risk is sort of mitigated. And for cholesterol, a statin medication like atorvastatin or rosuvastatin, that's really sort of the best medication that we have available to help patients get to that target level of LDL. And LDL directly reflects your atherosclerotic risk. And so, again, it always starts with a conversation about lifestyle modifications, ways to change your environments to be more supportive. Can you do more cooking at home? Can you eat more lean meats? Are there ways to cut out meats, cheeses, and dairies within your sort of nutrition guidance? But once we get to the bounds of that and the cholesterol is still elevated, then that patient might need pharmacological help.
I got you. So you mentioned the diet aspect of it. You mentioned meat, cheeses, dairy, so many others. So is there a difference for those people who decide to go vegan or pescatarian or vegetarian? Like, do you see a difference in their heart numbers?
Generally, yes. Now, I will say caveat, there are some genetic conditions that predispose certain patients to having high cholesterol. And so even still, if you're a vegan vegetarian, your cholesterol will be high. And so genetics makes up a decent portion of, how cholesterol is managed in the body. But certainly, dietary cholesterol does have an effect on, the numbers that we see. So traditionally, meats, cheeses, dairies, alcohol, and stress are sort of big main drivers, of the sort of dietary cholesterol that we see in people's biomarkers.
I got you. A big one that I often hear, whether it's factual or rumor wise, is it runs in my family. So, hereditarily speaking, a lot of things can be contributed through, running in your family per se. But what are some things that we can do differently to prevent those things and, stop them right here so they don't continue to run in our family? Hypertension being one of them, or heart disease being one of them.
Yeah, I mean, to your point, certainly there are lineages of phenotypes that we recognize that are associated with sort of malignant pathologies, meaning hypertension, hyperlipidemia. This could be plaguing your family. And so if you know that, you also have to be aware of what are some of the bad habits that also run in your family to support some of these things too, right? Because certainly there's certain like nutrition guidance that runs in our family that might not support normal blood pressures, right? Maybe traditionally your family is not a family that exercises. And so can you change the narrative about that to adding in, daily movement into your routine so that you're sort of breaking some of these traditional familial curses? And so, I think certainly, as modern medicine has advanced, we sort of understood more in the ways that which genetic has a role. But I don't want that to disempower people from feeling like you have the opportunity to intentionally prevent a lot of these diseases, because a lot of the power for prevention does lie within the daily routine, within the things that you're doing on a daily basis.
I got you. Appreciate that synopsis of that, because that's like one of the main things I hear. It runs in my family. I can't help it. I can't prevent it, or whatever the case is. So I'm glad you was able to lay some empirical evidence to that claim that people often.
Yeah. The
Um,
other thing I hear all the time too is like, I'll meet a person and we're talking about hypertension and their blood pressure, let's say maybe 160. And then they might say, oh, well, that's good for me. And, this sort of, we've accepted a sort of mediocre set point for our blood pressure because perhaps, you've never been able to achieve, a target blood pressure. And perhaps these things do run in families. And so sometimes people then just go ahead and accept that it is what it is, and this is what it's always going to be. And that certainly is not the case. We have so many tools available to us. We have so many medications available to us. I've never met a person that I've never been able to get their blood pressure under control. So.
got you, got you. So if you had to challenge somebody right now with three things to get their heart health in order, whether it's exercise or eating differently, what are some other things that people can do to, have a stronger heart if that's a thing?
Yeah, I mean, everything starts from your mindset. And so the thing that I always challenge people is to, take inventory, take stock about how you've been living your life over the last couple of weeks, and sort of make a red flag of some of the unhealthy habits that you can identify, whether it's eating out, whether it's not getting the proper amount of sleep, whether it's not consuming enough water, whether it's not prioritizing yourself for exercising and moving your body on a daily basis. I always tell people that exercise is like medicine. And so, in the same way that we tell people to take your blood pressure pills on a daily basis, we prescribe exercise on a daily basis. And you have a choice in life. You can either do your exercise or you can take a pill. And so, there's a choice. And so, in this sort of conversation about prevention, we're oftentimes encouraging people to exercise more, to defer, the potential pharmacotherapy. Beyond that, it's really a conversation about, how can I put myself in a mindset to prioritize myself and my health and my care? And I think once you get there and you're sort of accepting that this is something that I'm going to have to work at and work towards, then I feel like, that's sort of half the battle. I think in life, anything worth having takes effort and takes work. And living a high quality of life where you're avoiding heart disease, where you're able to do all the things that you want to do well into, your elder years, I think is a really valuable and worthwhile thing. But when you take a look back, that lifetime of healthy habits, that is what will support people aging properly and not having heart disease, not having heart attacks, not having heart failure. And it really starts at a young age, from 20s, 30s, 40s, 50s. Then we see the fruits of our labor as we get older.
Got you, got you. Appreciate that. So for me personally, I'm an active person. I do kickboxing a couple of days a week. I lift, I run. For those people who aren't as active, is there a difference in the cardio that people do? Because I tell people, hey, listen, you can stand up at work, you can do some calisthenics, you can walk, you don't have to run, but is there a difference in what you're seeing between somebody who's active at least a couple times a day or somebody who's not as active much, whether they, sitting on the couch or sitting down at work, taking the elevator opposed to the stairs? Like, do you see a difference in people who have active cardio within their lives and those people who don't?
Dramatically. And so, what I think you're defining is cardiac efficiency or fitness. And so, the marker for fitness or cardiac efficiency is VO2. And so, VO2, which is a marker of how well your body utilizes oxygen to create energy, which essentially determines how in shape you are. And people with the highest VO2 will live longer. When you think about cancer, when you think about heart disease, when you think about dementia, all people who have higher cardiac efficiencies or VO2 or fitness levels will live longer. And so to your point, there's a clear difference between people who are active and who move and people who do not. Now, that being said, that doesn't mean that everyone needs to go out and do kickboxing or run a marathon. Generally speaking, we recommend 150 to 200 minutes of moderate exercise per week. And that could all be on the weekend. Weekend warriors get just as much benefit from people who do it every day. Or if you don't have the time to do a lot of movement at a time, you can break it down into small micro sessions. So there is strong data that supports little movements, standing up, doing some push-ups throughout the day, or taking a walk around your building a couple times during the workday, or taking small little walks after breakfast, after lunch, after dinner. That has a synonymous effect as a dedicated workout routine. When you think about sort of step counts, generally the target that we like for people to see is 10,000. And so just incorporating these sort of micro movements or these sort of targets into your daily routine, that'll take you so far in life.
Gotcha. Appreciate that, man. Before I let you get up out of here, man, any other helpful tips or suggestions that you can leave with the people would be beneficial?
It's not really that complicated, to be honest. What I think is the more complicated issue is getting people to shift their mindset to prioritizing themselves, right? And so it's things that we already know that we need to be doing. We need to exercise every day. We need to eat healthy. We need to eat our vegetables. We need to get our sleep. We need to limit alcohol. We need to not smoke. We need to not stress, right? And so all of these things, everybody knows these things. These are the simple life sevens that we talk about that support a healthy life. But what ends up happening is life sometimes gets in the way, right? We let our job dictate, how much we exercise. We let our job dictate whether we're able to meal prep and eat a healthy meal that day. Sometimes we might let our finances dictate whether we're able to exercise that day or whether we're able to do. We let our moods dictate whether we're going to go outside and get our walk. And so all of these things about life that can get in the way of doing the simple things that we know, add life and years to mortality. And so the thing that I always preach, my role as a cardiologist certainly is to address the acute issue that's happening in front of me. But beyond that, it's to also take a step back and sort of look holistically at this person that's in front of me and try to identify why they're not prioritizing their selves, why they're not prioritizing their health, and then create a bridge or a barrier to get over that main issue. And so really, my goal for my work as a clinician is to just tell people to prioritize yourself. You are the number one draft pick. You are the MVP. You are the LeBron James of that team. And so, if we're not prioritizing ourselves, no one else will. So,
My God, definitely appreciate you, man. Definitely appreciate the opportunity for you to come on and educate the people, because I definitely think it's one of those critical things that aren't talked about enough. Specifically, like you said, the numbers earlier, heart disease is definitely number one killer, specifically too for Black men.
yes.
So I definitely want people to be educated as much as possible. That's why I try to increase these subject matter people that I have on here, so people can get knowledge, so people can know it is people out there who look like us who's doing the work, and they have access to those people. So for the people who want access to you, whether to send you an email, ask you a question, or come to a lecture that you're having, or hey, I know somebody in Maryland that I can refer. Like, what's the best way for them to do that? Website, email, social media, you can drop all those things.
Yeah, I'm online. I'm digital. You can find me pretty much anywhere. I'm on Instagram. I'm on LinkedIn. I'm on most of the sort of social platforms. So just my name, you can just type in Aubrey J Grant, and you'll find me there. I have a clinical practice in DC 2 days a week, and then I'm in Baltimore 2 days a week. So you could also find me there. And again, I mean, I want to give kudos to you for sort of having these conversations. I feel like, in particular, as Black men, we don't necessarily talk about these things. I don't know. We're not sharing our numbers with our friends, our homeboys. We're not really sort of talking about, hey man, what's your cholesterol? Did you check your blood pressure lately? What have your numbers been? And so sort of removing the stigma associated with talking about this, I feel like that's a really important thing. So thank you for having me today. If I can ever be a support of the work that you're doing, or anyone in your audience that ever wants to talk about heart disease, heart health, I'm certainly happy to do that.
No, man, definitely. I appreciate you for coming. I definitely put all your social media, emails, website, all those things in the description so people can reach out. And then hopefully people will pay more attention to that heart health as well as those lifestyle modifications that you mentioned throughout the interview. So I definitely appreciate you, man, and I'll catch you on the next one.
Yes, sir. Appreciate you, man.